delighted to be here, honored, always wanted to be an actress, so here I am on stage. It's very exciting. I think if I could just sing, I would get up and entertain you, but instead I'll just talk about a little bit about what we've done. I'm Dianne Timmering with Signature Healthcare. I'm Vice President of Spirituality and Legislative Affairs. Over the last 10 years, we've built the largest for-profit spirituality department in the nation. I have what I call the human app, if you will, which is a large chaplain army. And we've perfected it, as you do an app, right, over time, and that human element, and we are a portal into the chaplain meeting the needs of our people, both spiritually, emotionally, those who are going into the long-term care industry, new journeys, pain management, that type of thing. So it's that emotional and physical and spiritual need. So really happy to be here.
Compassion's sort of a fuzzy term that people get confused about. How would you define compassion, Dianne?
I think, and what we see is, I think compassion is not altruism. It's not altruism, and this is what I mean. I think compassion is an element of, it's a give-take, it's something you want to give in the sense that because we see the need that is so magnified in our long-term industry. So it's the point of listening, it's the point of touch, it's compassion is very specific. And what we've done on the compassion side, and again, I go back to the spirituality, we've been able to activate the intention of the power of compassion and operationalize this compassion, operationalize the spirituality into the actual healing process, like Dr. Doty was saying, like Jim was saying, you know, really making that, you know, whether it's pain management, whether it's the psychotropic, you know, it's a mental health or a dementia quality. So compassion is also the power of intention.
The good thing is we're here. There are people here talking about compassion. I know for us in my research and my colleagues' research, we use the definition of compassion as compassion is the alleviation of pain and suffering and the promotion of human flourishing. So it's not just enough to relieve that pain and suffering, but to actually promote the flourishing of another human being.
I like that. I like the human flourishing.
So how do you integrate this into business, Dianne?
One of the ways we've done, again, is a full-time chaplain army, but we go even deeper with that. Let me give you the recent technology, high-touch, high-reward that we just won with McKnight's magazine, just recognized. It's called the S-Tracker system. It's an S-Tracker prototype where we take the actual need, the actual real need of that patient, whether it's, you know, it's physical, it's you know, whatever that may be, and then we unite it with the chaplain encounter, and then through this S-Tracker system, we are able to interact and really operationalize and really care plan the specificity of the spiritual or the compassionate interaction and the intervention for the best outcome and for the best result. So that's where we've been empowered. I have a lot of studies that we've done. We have anecdotal, or we have qualitative and quantitative. One that I've done with your great university, U of L, on workforce productivity. But that's where we've seen the greatest power. We've seen it in nursing stability. We've seen it in employee retention. We've seen, we haven't really touched the needle on the psychotropic, where you've had a reduction in the mental anguish that our people experience, but we're working on that, not to mention the meds, right? Because in our industry, or our patient population, many times they're on 13 or more meds. So we want to, we haven't really moved that needle as much as I would like. But here's another way we've operationalized it. I mean, through the MDS trigger process, which is a minimum data set, which is part of our system and our process in long-term care. So when the MDS system triggers at a certain number, the psychologist or the psychiatrist is not only called, the chaplain's called as well. Because a lot of times, and Jim, I think you referred to this, what's the red hot center of the pain or the suffering or the anguish? And a lot of time a pill, prescribing a pill, especially in my industry, that seems to be the solution of the day. But what we've done is we've gone one step further and we said, let's get to the red hot center of why, where the torment is coming from, right? Is it guilt, regret, family issues? What is it? And so that is probably where we have just touched the needle. and where I think we can have our biggest really impact, and not just on the physical, and you refer to this, it's the physiological impact too. It's not just the emotional, right? It's the physiological. And in healthcare and long-term care, where we're going, everything is going to be value-based, and everything is going to be on the byproduct. What's the actual outcome? What's the outcome of that patient condition? So we see ourselves as a formalized, care planned, operationalized intervention, and that's really what we've been able to perfect with sort of this S-Tracker, even a prototype, which is an example, over the last, I would say, 2 years. Long way to go, but I think, it's an elixir. It's an elixir it's an elixir in this new world and, Wild West world of healthcare that we're seeing. I mean, don't you think too, though, we live in a world where you have to leave your spiritual skin at the door, which means your compassionate skin. You got to be a tough businessman, tough businesswoman. Where we have found where you just have to give them permission. You're out, how do you educate a workforce? Give them the opportunity to not leave their spiritual skin at the door to walk through. And so I think giving them permission to be spiritual, if they want to, it's a choice. It's a voluntary thing. Or to be compassionate too, I think there's an element of that. Just real quick on the question, we put together a spiritual and emotional intelligence class that we've been working on. It's an 8-week, but it's about seeing yourself anew through the emotional and spiritual intelligence of self-awareness, of coming together, and that's something we've kind of prototyped as well. And how do you teach emotional and spiritual intelligence? And that's how it starts to seep in. And the problem with the studies we've done is it has not had sustainability, I will tell you. Sustainability, people, is really important, right? Sustainability and scalability.
Talk a little bit more about that.
Well, what we do is we see it initially, they have this, this self-regulation, this self-control, this self-motivation to be compassionate. And I would say to be compassionate, and over time, if it's not something that is reinforced, thank you, partner, reinforced, then it doesn't have the full sustainability that you would like in the interaction of the caregiver to the patient. The study that I did with Mira, who's an associate professor in the Human Resources Department, there's evidence-based, academic, quantitative evidence-based around the power of, and you used a key word, of spirituality, compassion on workforce productivity. It enhances it. There's a freedom, there's a newness, the creativity, the confidence, the lack of fear in a meeting to speak up, all these things. So when we live in a world, especially in our world, the for-profit world, we live in a world of evidence-based, and Jim, of course, you've done a ton of research, but on compassion alone, but that evidence-based piece that we were able to discover through this U of L is very exciting. So yes, my answer is yes. If there is an ROI, if there's an ROI and there's an enhancement opportunity and an efficiency opportunity of the workforce, then definitely, even if it's just an objective reason to do it. Can compassion be taught?
Yeah.
His answer was that. I would say yes.
In what way?
I didn't say yes. I just gave a long drawn out. But the answer was yes.
Yes. Well, I go back to this, I don't know. I think, of course it can be taught, but I think it's more than that. I think it can be unleashed. It already exists. It can just be unleashed. And I mean, for example, let me just go back to this. Over a 10-year period, as you bring spirituality into the workplace and God into the workplace, whatever that divine means to the human heart, you have to have your ducks in a row. You got to do your research. You got to know that it's a First Amendment right, really. It's Title VII of the Civil Rights Act. There's even a UN resolution from 1958 that says that you can practice spirituality or religion in the workplace. Most law cases come from people not being able to practice. I mean, that's where most of, and that's misunderstood, if you will. So I think, again, I go back to, my team, sometimes it's simple. We put together a 3-minute video saying permission to pray. If you choose, you have permission to pray with a resident. You have permission to pray with a family member. It's 3 minutes. It talks about some of these things. And I think we just have to give the permission to unleash the human heart.
When you're talking about compassion, what about poverty? People who don't have food to eat? How could they even think about compassion?
It's a great question because, of course, we have our CNA, our certified nursing assistant. They may make $10 to $12 an hour. A lot of them are single parents, slugging it out in the eastern parts of the state, rural America. Some of their kids, may be have issues for drug addictions, for example. That's what we see. So that's a great question. So compassion is great, but it's really more about the faith and works, because compassion has an element of faith to it and kindness to it. But there is a piece where we've developed the Compassion Fund. We've raised $1.3 million over the last 3 or 4 years. And now it's a first responder in a crisis situation. And it addresses crises for sure, but it addresses a lot of the poverty our people face, or a spouse losing a job. So that is one way where we can definitely, where we've been able to, again, operationalize the power of compassion beyond just an emotion, beyond just an action, but with something that has a physical tally to it, a physical, financial tally to it. And we're just, again, tapping the iceberg. We're looking at food kitchens and all kinds of things now. Clothing, soup, socks, and scarves is something my colleagues where we're addressing these poverty issues, because our stakeholders then, there's an element of, and I say I'm not a big proponent of altruism, because there's also an element of the better prepared your employee is, the more stable they are, they're going to be a better caregiver. It almost sounds like we need to have compassion as a unifying theory pretty high up to get down to the bottom. And that's a lot of times we forget about that. What do you think about asking for compassion? I had an encounter with my stakeholder today, getting a PowerPoint ready for today, and I'm so glad we didn't use him, but I did have it. And I pushed and pushed and pushed, and she got teary, and I pushed her too hard, and she said something about, we talked, and I suddenly realized I needed to have compassion for her. She asked for it. So I think there's asking for it as well, and not assuming it's just a one-way interaction. I think that's what I was trying to say earlier. It's not assuming it's just a one-way interaction, but even asking for it, and which she did for me. And I was so ready to give it to her, amplified.
Yeah, and it is something that we have to be conscious of on a moment-by-moment basis. But what about those people that are not? So take organizations. We have, in the city of Louisville, we have close to 100 organizations that have signed compassionate charters. So they're committed to compassion. Yet within those organizations, there are people that really don't buy into compassion. What do you do in that situation?
Compassion and really getting it into the heartbeat of a company was the biggest challenge we had. So my team and I, we had to develop a real structure, a real framework, a real structure for it to be distributed, if you will, in the 10 states that we represent. You can't just have it as a dimension. One, it's compassion, and building it into the corporate world is not flat.
It's not a mission statement.
It is not a mission statement. It has a huge dimensionality to it, and you have to build the scaffolding and the framework like you would with any business model, because right now, spirituality is almost a part of our business. It is a part of our business model, including the palliative care piece we're about to launch. So you have to build that framework so that it's real within the confines of these 100. And that has been, I'm so excited about that being a movement within our city, and we certainly are, our mayor's awesome and the forward thinking in it, but has it truly been activated? And that's always I would say, a private concern of mine. But I think it has to have a framework to be really real.
So two-part question. How will we know as an organization that we are compassionate, and how will we know as a city that we're compassionate?
Oh, wow. I would say this is how I know, because I would say 65 to 70% of those recruits that come to Signature, and we're almost a 20,000 person company in 10 states, come because they want to practice their compassionate spiritual side. So we've become sort of a revolutionary movement as it relates to that, and it's infiltrated over a 10-year period sort of this, it's uncontainable beyond the walls, and that over time, that's how I know, because they're coming for it, and they want it. Freedom, when you can really be who you are and have that, there's a quality of freedom I think a lot of our people experience. You can't buy that.
I want you to do one more thing before you leave, and thank you all for coming.
Yes, thank you so much.
Stand up and tell the person next to you how amazing they are. We don't hear this enough. You didn't even know. Just say it.
You're amazing.
Just tell the person
You're
next to you,
awesome.
thank you all for coming.